Hello, I am the orthopedic nurse navigator for joint replacement here at UT Medical Center. Welcome to shoulder replacement discharge class. You will go home with a sling placed on your surgical arm. This is sometimes called an immobilizer. You will need to wear the sling till the surgeon gives permission to remove it. Be sure to always have your sling in place when sleeping. You will have a restriction in how much weight and pressure you can put on your surgical arm after surgery. Do not use the surgical arm to push up in bed, roll over, or push up from a seated position. Do not lift anything greater than 5 pounds with the surgery side arm. And remember, do not lift, reach, push, or pull anything above your waist. It is okay to do simple small things like holding a small book, remote control, or cell phone. Coughing and deep breathing after surgery is important to re-expand lungs and help prevent pneumonia. Take 10 slow, deep breaths and cough once an hour while awake. If there is not any issues with breathing, it is okay to stop using the breathing machine on post-op day 10. The surgical bandage will need to be changed on the 3rd day after surgery, and then every other day until seen by your surgeon. Important steps to remember for changing bandages is to always wash or sanitize your hands before touching the surgical site or the area around it. Remind your caregiver to also wash or sanitize hands when they are assisting you with your surgical bandage. You will remove the old dressing and replace with a new 4x4 gauze and secure with medical tape. Do not put any ointments, creams, or lotions on your incision. You can shower on day 5 after surgery if you do not have any drainage from the surgical site. Take care to pat your incision dry and do not rub the surgical area. Do not soak the surgical arm in a tub or any container of water. If your incision starts to drain, call the surgeon's office as soon as possible. Pain after surgery is expected and will likely be worse somewhere around post-op day 2 or 3. The opioid pain pills are prescribed to help control the pain after surgery. Always take pain medication as prescribed. You may take less than prescribed. A couple tips would be starting with the lowest dose first, or taking half a pill at first rather than a full pill. Another tip for pain management is to use over-the-counter Tylenol or acetaminophen, which is the generic name. You may wish to add the doses of Tylenol with the opioid pain pill, or you may alternate between the doses of the opioid pain pill. Make sure to not exceed more than 1,000 milligrams of Tylenol at a time, and do not take more than 3,000 milligrams in a 24-hour period. It is helpful to have your caregiver keep a list of medicines, the dosage, and time of day you are taking them. This will help you keep track of all your medications and prevent accidentally taking too much. Another great pain relief tool is ice. Ice helps reduce pain and swelling after surgery. There are different types of ice packs, and you can use whichever works best for you. The guideline for ice therapy is to use the ice pack for 20 minutes out of every hour, and then give your incision area and the skin a chance to warm and circulation to normalize before replacing the ice pack. Keep a clean towel or pillowcase between the ice pack and the surgical incision area as a barrier. Setting a timer is helpful to maximize ice therapy effectiveness. You will not be able to drive after surgery. You will need permission from the surgeon to resume driving at the appropriate time. Do not drive while taking prescription pain medicine. These are some of the medications you may be given after surgery. Not every person will receive every medication. Some of them are as needed and some are prescribed by the surgeon. If you have questions about any medications you are given, please ask your nurse or reach out to your surgeon's office. Constipation can be a common occurrence after surgery. There are several things you can do to help prevent or treat constipation. Getting up and increasing activity, drinking adequate amounts of water, eating a balanced diet with high-fiber foods, and using over-the-counter stool softeners and laxatives will help if you are constipated. Do not let more than 1 to 3 days pass without having a bowel movement after surgery. If you are having difficulty with constipation, please call the surgeon's office for recommendations, or you can reach out to the orthopedic nurse navigator. Sleeping and getting rest after surgery is important to aid in healing. You will need to sleep on your back with your upper body supported by pillows. Use a pillow under the surgical arm to provide support. Make sure the sling is secure when sleeping. It may be helpful to use a recliner chair for sleep for a few nights after surgery. You will want to prevent infection while you are healing from surgery. Always wash or sanitize your hands before touching any area around or near the surgery site. Monitor your surgical site and the skin around it for any signs or symptoms of infection. If there are pets in the home, do not allow them in the bed where you sleep or to lay near the surgical site. If you need a medication refill, call the surgeon's office during business hours. The surgeon's office will need 48 hours to process the request for a refill of medication. You can plan to call before you run out of medicine. Please call the surgeon's office if you have any urgent problems. Reasons you may need to notify the office would be for a temperature greater than 102 or higher for greater than 24 hours, any infectious drainage from your surgical site, a dramatic increase in redness and warmth around the surgical site, new chest congestion, severe calf pain accompanied by increased swelling in legs, pain that is increasing after taking pain medication, new dizziness or confusion, blood in stool or urine, and if you fall or injure the surgical extremity. If urgent questions arise that cannot wait until regular office hours, the surgeon's office has an answering service and a provider on call. Be prepared to give your name, date of birth, surgeon's name, and date and location of your surgery. The provider on call will get a notification of your question and will give a call back. If you experience any chest pain, trouble breathing, or shortness of breath, call 911 or go to the nearest emergency room. For successful recovery from surgery, make sure to keep all follow-up appointments, take medications as prescribed, complete physical therapy programs, be active, and eat healthy. Thank you from your healthcare team here at UT Medical Center for allowing us to be a part of your joint replacement journey.